Good afternoon. First, I would like to apologize for running a bit late. The doctor just had an emergency. So, thank you so much for joining us today, a new session with Medcare Hospitals. Today, I would like to welcome Dr. Rahul Chaudhry, a specialist dermatologist at Medcare Medical Center at Discovery Gardens. Today we're going to talk about eczema and the causes of it, and I know it bothers a lot of people, especially during the times that we are going through with the excessive use of sanitizers, gloves. So I know that people are bothered with this. So that's why I think it's the best time to raise the questions that we have been receiving over the past couple of days since we posted the session on Instagram and Facebook. So please, I would like to encourage you to share your questions, and the doctor will be more than happy to answer them. Doctor, thank you so much for your time. And sorry about the confusion. And I know that it was an emergency. Doctor, today we would like to talk about eczema and the causes of it, where it hits most, and we're not going to only cover it for adults. We'll also touch point on the children's eczema.
Yes.
I know they get affected with it, especially during summer, using the swimming pool and again, not to mention the excessive use of sanitizers and gloves.
Yes.
So where would you like to start from first? How shall we talk about a simple definition of eczema?
Exactly. Good afternoon to my viewers. Basically, we have to understand the word eczema. Eczema doesn't relate to any disease. It is basically a symptom. So it's like somebody having fever. Now, fever can have 10 different reasons. Similarly, an eczema is a symptom which actually means itchy, inflamed, red skin. There are multiple reasons for eczema. Predominant amongst them are the eczema that is seen more common in kids. We call it as an atopic eczema. The second most common is a contact eczema. Eczema happening because of coming in touch with certain allergens which can give you an allergy. And then there are other rare eczemas like some kind of nummular eczemas, stasis eczemas, seborrheic eczemas. But primarily the eczemas that we see in our clinics is either atopic eczema, which is kind of a genetic predisposition of skin in which the skin is very sensitive to food and certain environmental triggers, and obviously the contact eczema, which is mainly due to the due to the allergies for which a person comes in contact with. So these are the two predominant eczemas that we see.
Okay. Doctor, can it be transmitted from one to another?
No, eczemas are not at all contagious, no matter what the underlying reason for an eczema is. These are non-contagious, and a person cannot give it to other person by touching or coming in contact with him.
Right. So how would a patient know that he is suffering from an eczema, not an allergic reaction or just a normal rash on the skin?
Like I said, if a person is having a itchy skin which is inflamed, means it is swollen and it is red and it's been there for a while. And then for certain eczemas, there are certain areas of predisposition. So let's start with the most common one, like atopic eczema. This is probably the most common eczema that you see in clinics. Usually it starts in children. By the age of 5, kids have atopic eczema. And here the main areas that are affected on the skin are the flexors. So wherever there are skin folds, like in the neck area, in front of the elbows, behind the knees, wrist areas, a child will have a very dry, scaly, flaky skin which will be really itchy and it would break down at points. You can see some liquid coming out of it. So this is an eczema which has a genetic predisposition. If you take a proper history of such patients, you may find a history of eczema in the family. So that further strengthens the diagnosis. These eczemas usually, the norm is by the time a child turns a teenage, which is about 10 or 12 years of age, these eczemas usually disappear. But during that time when they are active, you have to counsel the parents. You have to tell them, what all treatment needs to be done. We will come to that later.
Sure. Aside from genetic eczema, can it be, can it caught by maybe going to the pool or the chlorine and the swimming pools?
Yeah. So when I say the word a child's skin is genetically predisposed, that means a person's skin is more sensitive. So the skin is becoming sensitive to anything and everything in the environment.
Yeah.
So whenever such a sensitive skin comes under certain things, like suppose a person is having a shower with a hot water, they're using soaps, chemicals on their skin, or they're going to a pool and chlorine is coming in contact with such genetically sensitive skin, the skin will break out.
Right.
So for such people, we usually advise them to not take shower with very hot water, use cleansers which are soap free, try not to sweat a lot, try to avoid chlorinated water, but if they are using swimming as an activity, then they should moisturize the skin before and after. And also in the environment, you have these dust mites, you have pollens, you have molds, you have danders, animals, which, like if you have pets, then you have animals which are furry. So all of these things also kind of irritates the skin, and that can bring out the rash. So we advise our patients back at home to kind of declutter the room, have a deep cleaning of, doing a vacuuming of places like rugs, carpets and curtains and all that thing. Even simple usage of soap should be limited. Sanitizers should be limited because these are like alcohol 70%. So anything can irritate the skin. So any product which has a tendency to make your skin dry will flare up your eczema.
Right. Doctor, what is a severe case of eczema?
Severe case of eczema can be defined as a case in which over a certain area of the body is involved. So suppose somebody is having eczema which is disturbing their sleep, disturbing their quality of life, and it is so itchy that they are kind of itching it maybe throughout the day. And the areas involved are more than the usual. So suppose somebody is having eczema which is involving vital areas of the body like face and arms and legs, and if the itching is so severe that when they are scratching the rash, it is kind of oozing some kind of discharge. So these are considered to be more severe cases of eczema.
Right. What kind of skin that has more tendency to eczema? Is it the dry skin or the oily skin?
Dry skin will definitely have a more tendency to eczema. That's why we try to shift the spectrum from using a moisturizer. Like we want a dry, if a person has eczema, we advise them to moisturize their skin very well, to use a moisturizer multiple times in a day. That will moisturize the skin. So dryness of any type will flare up, eczemas of any type, whether that be atopic eczema or eczema because of some allergies.
And the questions, I've already started receiving questions.
Please.
So
I would like to keep it simple without using a lot of technical terms. Just want to give you a little bit information about it so that you can kind of catch it from there.
That's perfect. Just for the audience who just joined the session, today we're talking about eczema, the reasons of getting eczema, how can we cure it, and if it's curable with some sort of medication, or that's what the doctor will talk about. So thank you so much for the questions. Please continue sending them, and the doctor will be more than happy to answer them. Doctor, so a question here about using moisturizing regularly. So, but still the skin is dry. Is it a type of moisturizer that it's not affecting the skin, or like, let me put the question, do we do like a skin test so we know what is best for us to use?
No, when a patient walks in with eczema, we have to first decide what kind of eczema is it. Is it just mild eczema with a little dryness here and there with no, subjective itching happening? It's just a dryness. So those cases can easily be managed up with precautions and a moisturizer. You really don't need to give any medicated treatment for them. But yes, moisturizer is important because most people have this misnotion that using a normal, OTC moisturizer from a supermarket is good enough. No, we have developed a lot lately, and we do have really good moisturizers.
Like medicated ones?
Not those which are harmful, but something which is similar to what our skin is made up of. So we have ceramide moisturizers coming up in the market. Our skin is made up of ceramides and other components. So now we have very specific moisturizers coming up for eczemas. So I start with a moisturizer for a very mild case of eczema, and preventions and precautions, what we just discussed. If the eczema is more than that, if it is a moderate eczema where there is a visible rash, you can sense that there's a rash which is oozing something, or it's a thick skin on certain areas of the body, then you do need to give some medicated treatment also. That comes in the form of creams. So we start with a cortisone based cream and a non-cortisone based cream. Both are medicated. We give that for a few weeks, and depending upon how the eczema responds, if it responds good enough, we taper down the creams, we stop them, continue the moisturizer. For the itching, we add an anti-allergic tablet. So this is the basic pyramid of treating an eczema.
Right.
You start with a moisturizer, you add some medicated creams, you add an anti-allergic, and then the other advanced things comes up. So if it is not controlled at this point, then you have to add more advanced thing. One not so good news is we can't put eczema, especially the atopic eczema that I'm right now talking about, under cure.
Okay.
So by cure, when I say what a person concept of a cure is, okay doc, you give the treatment for a week, 10 days, it's gonna go away and never gonna come back.
Sure.
So atopic eczema we can't place in that category. There's always a chance of it to come back. Like I said, 70% of people, they are completely cured by the time they turn 12, 13, which is your teenage. But rest of the 30% can have eczemas which can come and go.
Right.
So it's a chronic problem which requires a chronic solution. And if it is not controlled by those medicated creams, then we come on to the next step. So which I'll discuss in the next few questions.
Perfect. Doctor, when a patient gets an eczema, does it leave a mark?
Yes. Especially in some skin types, you can say the brown skin types, if there is an eczema, it can leave a temporary mark. So whenever there is a redness, it will invariably be followed up by a dark skin in that area. But those marks are just of cosmetic concern. Those are not itchy or anything, and with time they do fade away by giving some lightening products.
Okay. We don't want to promote a moisturizer, but what's the component that we should look for in the moisturizer that we use on daily basis?
See, there are obviously
and what to avoid as well.
Yeah, obviously we don't want to promote any moisturizers, but you can see 8 or 10 good different companies are available right now in the market who have these moisturizers. And I said one of the important things is ceramides.
Yes.
Some of the moisturizers are having some proteoglycans, which is another building product for the skin. Sometimes they have hyaluronic acid, which is also good. They have sometimes vitamin E added to them. They are also good. So in general, all of them have their own patented products as a moisturizer component, but all of them are kind of good in giving up the response. So a moisturizer is bare minimum. The good thing about moisturizer is it's not a medicated thing. So even you can use it without a prescription. So if you're using a moisturizer for a year without meeting a doctor, I'm not worried about it. But if you're using a medicated cream without meeting a doctor, then that's not good.
Right.
So moisturizer should be used for long, and I can't overemphasize on the fact that this is the building block for a patient for eczema. People unfortunately don't take it that seriously. They are mainly there to get things like a medicated cream or some tablets or some other things, but we have to make them understand that this is a chronic problem, and if you moisturize your skin well with a good moisturizer, these things will stay under control.
The moisturizers that's out in the market that says it's fragrance-free, are these good?
Yes, these are the good ones. Now, most of the companies are coming with fragrance-free. So, less number of things are there in a moisturizer, better is it for an eczema skin. Because in the beginning, I told you, the eczema skin is very sensitive to everything and anything.
Right.
So, a general moisturizer which you buy from a supermarket, they have all these chemicals in them, like for the fragrance, for a good perfume kind of a feel, and other things which can be counterproductive. So when you're using a moisturizers which has a lot of fragrance in them and a lot of chemicals in them, they have just added to improve the texture and everything, that can be counterproductive and it can give you a more eczematous skin. So most of the moisturizers that we have are more inert, fragrance-free, no fragrance, nothing, and suiting for the eczema skin.
Perfect. What about applying a vitamin E directly to the skin?
Not necessary. No, not needed actually. Like I said, we are limited in applications. I can't expect my patients to have 4 or 5 applications throughout the day. So if you have to choose one, because I have people coming up, they're saying we have some oil. Can we apply a coconut oil or an olive oil?
So they're home remedies, and
they're just home remedies. They're not substitute.
Right.
So if I have to give you one thing, I'll give you a perfect moisturizer which has all the things in it, whichever is needed, rather than telling you to apply coconut oil and applying vitamin E or something separately. Just use a good moisturizer at least 2 or 3 times a day. And the best time of using a moisturizer is especially in the morning after you have taken a shower. So pat dry your skin. So when your skin is a little wet, just just apply a
Apply
thick
it.
layer of
Okay.
moisturizer.
That
on
keeps
that.
the moist
That
or
keeps the moisture for a longer
Right.
duration. Yeah.
Okay. Doctor, now a question from housewives in general,
Yeah.
and getting exposed to a lot of soap and
Yes,
chemicals and
yes,
water
yes.
several times a day.
Yeah.
What's your advice to avoid getting an eczema because of that? Yeah.
So what you're talking about right now is mainly the hand and feet dermatitis.
Yes.
So, you have this dermatitis which usually happens on the fingers. So you will have a male or a female coming to you with some cuts on their fingers, which is mainly in the predominant hand they're using.
Yes.
It just means that their skin is a little dry, and whenever they are using any soaps or any chemicals, even a sanitizer, or they are using laundry or something to, wash the utensils, they're using something to clean their clothes. All of these are very harsh on the hands. And sometimes when we are not taking enough precautions and we are wetting our hands a lot, or when somebody is working in the kitchen and they are cutting vegetables, especially something like onion, garlic, tomato, so those vegetables which has some fluid in them. So when that thing comes in contact with the skin, those are very strong acids basically.
Right.
And that kind of just irritates the layer of the skin, and it just kind of opens up the skin and you have these cuts coming up. So firstly, if you're talking about palms especially, let's go to that specific area that we're talking about. So palms is the area, hand dermatitis.
Yes.
So the prevention is obviously easy to say, difficult to follow, but don't wash your hands again and again. Don't use sanitizers more than it is needed. Use a soap-free cleanser to wash your hands. So there are certain cleansers in the market which are soap-free. Soap is nothing but a detergent. So you have to go for soap-free cleansers which are very gentle for your skin to wash your hands, and always use a hand cream as a moisturizer. Now what's the difference between a regular moisturizer and a hand moisturizer? Most of the hand moisturizers have urea in them. Now urea is known to be a humectant. Urea stores water. So it will keep water there for a longer time. So I do prefer hand cream which has urea in it. So you can go for a urea hand cream. And just like a moisturizer, it doesn't have a frequency associated with it. You can use it n number of times. So you just keep it near your wash basin. Every time you are washing your hands, just use a hand cream multiple times. If it is more than that and it's not getting under control, then you have to start a medicated cream, something like a cortisone based cream, which you will get it from your doctor. Apply that for a few weeks, the eczemas will improve. You continue using the hand cream, you continue taking the precautions, things will stay under control. Gloves also have a role here.
Absolutely, that's my point.
I knew that.
The overuse of gloves and the less use of gloves. So we don't know now. If I wear gloves all the time, again, during COVID, and some people tend to wear gloves to protect themselves, for sure, that's understandable. But if I use it a lot, sometimes you wear gloves and it has this white powderish, and it keeps the skin dry.
The powdered gloves are an absolute no, because the powder will absolutely irritate your skin. Even latex glove is something that I will not prefer. People are allergic to latex a lot. Latex is rubber. What I'll prefer, the most hypoallergic gloves that we know is PVC gloves, polyvinyl chloride gloves. So PVC gloves, you can get it in supermarkets. So we have to do house chores. So washing utensils, something that is not absolutely unavoidable. You can wear PVC gloves to just do the house chores. Still, there will be a bit of an absorption, but it is still okay than the other things. Cotton gloves is another thing that is acceptable, but avoid plastic, leather, especially the latex gloves. And powdered ones is an absolute no.
Okay. Doctor, you mentioned that eczema can appear in the face?
It can appear in the face, mostly when we talk about infants.
Okay,
so that's
for
the
infants.
difference. Infants. Up to 1 year of age, the location of eczema is different. It's mainly on the scalp, face, the shin areas. Over 1 year, location changes. It's mainly on the folds.
Right.
So you have the neck, you have the front of the elbow, back of the knee. So these are the areas involved. So I'm not saying in adults you don't have face involvement. It is seen, but mostly the face in eczema is involved in kids, in infants.
Right. How can we protect the infants from getting eczema in the face?
Yes. So first of all, when a child is born, now who is predisposed to eczema and who is not? Like I said, it's a genetic condition. So if there is a family history of either eczema, so either father or mother or their first degree relatives or someone in the family had eczema in the past, number one, or there is a family history of allergic rhinitis. So whenever you're going out, you have a dust allergy and you're sneezing and all that. Or they have an asthma history.
How is that moved to eczema? If I'm allergic or I'm sneezing, how can I relate that to an
All are
eczema?
related. There's a term known as atopic march.
Okay.
That's the term. So the thing is, it's all in sequence. I'm not saying every kid will get it, but
Case
there
by
is a
case,
chance,
yeah.
case by case, that a kid will start with eczema, go on to have asthma in their teenage, and later on in their life they may have allergic rhinitis where they may sneeze at a little dust or something.
Okay.
So this is known as an atopic march. All of them are related. All of them are basically a simulation of your immune system. All of them are IgE mediated. It's just the organ which is changing.
Right.
So a dust allergy in your childhood can give you a rash. The same dust allergy in your teenage can give you breathlessness in the form of asthma, wheezing. And the same dust allergy in your adulthood can give you this allergic rhinitis. So it's mainly the same thing, just the organs are differing. In one case it is skin, in one case it is the lungs, in third case it's the nose and the eyes.
I think this is very new. I mean, at least for me, I didn't know that there is a relationship between an asthma or an itchy. Yeah.
That's why we have to tell the predisposed. So whenever a person with eczema comes, suppose I see an infant 8-9 months and I feel this is eczema. Automatically, my first question to the family is who has a history of asthma, rhinitis, or eczema, or if you have another kid, how is his skin and all. So if they say the father side or the mother side there's some history, then I tell them, okay, the kid is predisposed for eczema, so we have to take care of the skin right at the beginning. Exclusive breastfeed kids have a lesser chance of eczema, because the mother antibodies have a protective role, and we don't introduce anything solids by 6 months. So if the kids do have any allergy, that is shown up later. Main food items to which an infant can have eczema is cow's milk. That's at the top of the list. If an infant is having eczema, it is because of cow's milk. Egg, nuts, sometimes shellfish, fish. So these are the things. But you don't give shellfish to an infant. So mainly it is nuts. In some food items, you can have milk and eggs. So these are the three things which needs to be figured out.
I'm going to build my next question on the point of food, and also we got it from the live session here from our audience, and thank you for sharing your questions. Please keep on sending them. Food allergy. What food should we avoid if we have eczema?
Yes, important topic. I won't overemphasize on food allergies, and I don't really push my patients to undergo a food allergy test, because sometimes it's not very specific that if you're allergic to a certain food items and if you stop that, the eczemas will improve. But we do in general tell all our patients of eczema, especially infant and the kids, that try to limit the cow's milk.
The cow's milk.
Yes, it is the number one reason if you talk about food and eczema. So cow's milk, egg white, wheat at times can aggravate eczema. Fish, shellfish, and nuts of any type. So nuts, we tell them to kind of limit the consumption a little bit. We can do an allergy panel or allergy test for them. But like I said, I won't overemphasize on that point. Sometimes the allergy test shows you're allergic to 20 different food items, and we don't want to compromise the nutrition.
Right.
So if I start telling my parents that, okay, you stop all these 20 food items, the nutrition can get compromised. And that is also not a very accurate, prediction that if you stop these foods, the eczema will improve.
But manageable for adults.
Manageable for adults, definitely, and because we have a lot of options and choices. But for kids, yes, we do tell them that if you're giving a cow's milk, try to change that, or try to change the formula or something or the other, and don't give eggs and nuts and all these things we can.
It triggers it.
Yeah. So there's definitely a correlation between the two.
Right. Doctor, I got a question now from Facebook regarding dandruff.
Yeah.
And is there common between having dandruff and eczema?
See, like I said in the beginning, eczema is not a disease, it's a symptom. So one of the eczema is seborrheic eczema. This is what dandruff is.
Yeah.
So dandruff, when you talk, biggest misnomer or biggest irony about dandruff is, because I ask my patients also to understand what their point of view is, dandruff means you have an oily scalp. It's not a dry scalp.
Okay, no, we
The
thought
flaking,
it's the other side,
most of the
it's
people
dry,
feel
it's
that.
flaky.
Exactly, it's flaky means it's dry.
Yeah.
You use more oil
like
on
the
that.
skin.
Yeah, like the skin. So if you're talking about dandruff, that is a fungal infection. It kind of suggests that the scalp is oily. and the fungus which is usually there on the scalp of everyone is overproducing its food by using the oil from the scalp. Now, flaking on the scalp because of the atopic eczema is dry.
Yeah.
So we have to differentiate between the two. So suppose a person is coming to me with atopic eczema, which is dry skin, and if they have a flaky scalp, maybe it is the dry scalp and not the dandruff scalp. But the moment you use word dandruff, dandruff is equal to oily scalp, and you need to give some anti-dandruff shampoo, stop using any oil or anything, and if more than that, you can give some medicated lotions.
Okay. Again, I've been receiving a lot of questions regarding the brands of moisturizers that we should use. I know we're not here to promote any kind of brand, but the most common question is about Cetaphil and again the ones that we see in the market and how they market it.
It's
right?
a very, very easy answer to say here. Like in Dubai, we are sitting at a very privileged place where we have really good companies having really good products.
And good marketing.
Marketing. So for me, there's nothing like a bad or a good moisturizer. It's all about suitability. So I have given X company moisturizer which has suited a lot of people very well, but then a random odd patient will come and tell me this didn't suit my kid, but I'm using Y which is suiting my kid a lot. I'll ask, okay, what is Y? So I'll just Google it out, and if I'm okay with the components, I'll tell them to continue Y rather than enforce X on them.
Right.
So I start with some things that I use more often than others. Cetaphil is a wonderful company, no two thoughts about it. They have a special range for eczemas. We have to use that special range.
Yeah.
Because now since you brought up Cetaphil, people are there, I'm asking, okay, you're using something? They're saying, yes, we're using Cetaphil cream. I said, just Cetaphil or something Cetaphil plus? They're saying, no, just Cetaphil. So that is not meant for eczema. Cetaphil has a dedicated moisturizer for eczema. It is Pro Eczema Moisturizing Lotion, comes by that name. So we have to go for that dedicated thing. But again, if you feel that a certain moisturizer is doing its job, and I feel it is having the right components in it, I don't feel any reason to change it.
Okay, so I hope that we answered the question about the products for moisturizer. Again, it depends on how your skin is reacting to. Maybe a product can work for you, could not work for the others. But again, it's all about the components and the ingredients that we need to avoid. That what the doctor mentioned earlier. What we need to avoid in a moisturizer or anything that we apply on our skin. Right. Okay, doctor. There's another question which is around the flaky scalp.
Yeah.
So we said that, which I did not know of, and having an oily skin or a dry skin could cause dandruff. So it's the oily skin.
It's the oily skin which causes dandruff. You have to see the age group. So suppose a person of like a kid, teenage, 13 years coming to me with acne and a flaky scalp, automatically that flaky scalp is dandruff.
Right.
But suppose somebody 25 years, 30 years is having a flaky scalp, but he didn't had any kind of acne or anything.
Eczema or acne or
it
rash.
may be psoriasis. Now, psoriasis is a flaky scalp. That's another dermatitis or kind of an eczema. But here the scalp is flaky, but it is dry flaky and not the oil flaky. But dandruff, the word dandruff is a oily flaky scalp. But there could be other reasons for flakiness on the scalp.
I have another question. Wearing only cotton clothes, is cotton wearing cotton clothes it helps it
helps a lot. So when kids are coming to me with their parents, I'm telling their parents fabric.
Yeah.
So the parents are giving me a history. As soon as my kid comes in contact with something which is not cotton, it just flares up. So anything which is woolen or nylon or terracotta or synthetic fiber will irritate your skin. What's the most inert thing? 100% cotton. There's nothing more inert than 100% cotton as a fabric. So we encourage all our patients of eczemas to use cotton as a first layer of clothing. Because the moment you start using something other than cotton, and if it is coming in contact with your irritated skin, the skin is just gonna flake like anything.
Right.
So cotton is the preferred clothing.
And organic cotton.
Organic cotton better.
Yeah, because now we've seen a lot of brands moving
where there's
to
a mixture of
cotton.
cotton with something. So organic would work well. And also while washing these clothes, use less detergent. Try not to use a lot of detergents, because washing clothes of kids, you can have these traces of detergents which are left up in the clothes. So when the kids are wearing those clothes and going out for activities, those detergents can bleach in your skin and irritate.
Right.
So we advise multiple rinse washes of clothes and using a very gentle cleanser for washing the clothes.
getting exposed to the sun. So now with the summer and the heat that we have here, the heat wave that hits the Emirates, sunblock using sunblock, would it help getting affected with eczema, or this is not relevant or
Eczema
related
is
to
not
it?
directly related with sunscreen as
No.
such,
Okay.
though you should use a sunscreen all the time.
Yeah.
Okay, we have lotions, sprays, gels, creams. We have different varieties of sunscreens. Even sun exposure and eczema is very debatable, because one of the treatment for eczema is phototherapy. So for moderate grade eczemas, we advise our patients to undergo phototherapy, in which your body is subjected to certain rays. So in fact, sun exposure may improve eczema, but this is a very controversial thing. So we don't advise our patients to go out and sit under the sun who have eczema, because this is a controversial topic to touch.
But applying sunblock or
Apply
sunscreen
sunblock
on it
all
is
the
okay.
time, yeah.
Even if you have an eczema, you can
to
apply
use a sunscreen which is which doesn't have a lot of chemicals in them. So there are more inert sunscreens that you can use in a lotion form.
Right.
Because sunscreens have little chemicals in them. So if you use on a eczema prone skin, it can irritate the skin.
So again, to the point for the sunscreen, the SPF 70, the SPF 50 and 30.
It's all
what's
commercial.
the ideal? Yeah.
It's all commercial. So it's like a graph. So as your SPF increases, your sun protection increases, and at 30 SPF, the graph plateaus. So anything over 30 is good enough.
Okay.
15 is not enough, 15, but anything over 30. Suppose somebody is using 30, 50, 70. I'm okay with over 30. Because this commercialization will keep happening. Now you have 100 SPF.
Right.
5 years down the line, you will have 150, then 200. But the extra protection is not there. Like 30 SPF is giving you 97%. 50 SPF is giving you 98%. 100 SPF is giving you 99%. So it's marginal. So anything over 30 is good enough as a sunscreen.
Doctor, I also got a question from the live here. It's about the hand eczema and the moisturizers that's not working, and the excessive use of sanitizer, which we already spoke about, and using gloves, which makes it sometimes worse because the kind of gloves that probably you're using. So she's saying here she's using Dermovat.
Yeah, that's a steroid-based cream. Yeah.
Yes, at night, and Protopic in the morning.
That's a non-steroid based cream.
Yeah, but still they're not effective, so they're not helping.
Yeah, I mean, maybe it is not an eczema, maybe it could be psoriasis on the hands, which is a different kind of a dermatitis. Or maybe we are using them but not moisturizing the hands enough, or we are doing everything okay but still the exposure is there. If this treatment is not enough, we obviously have a second line and a third line where you start introducing some tablets to take care of such hand eczemas. But hand eczemas needs to be moisturized. Both the creams that she is using are pretty okay to do, but not for very long.
Right.
And we need to see to it if it is a specific type of an eczema like psoriasis, where the treatment is different from the regular eczemas, or it is just an eczema to soap and other things.
Dr. Rahul, we're still receiving live questions. I'll just make it very quick. I know we're almost out of time, but there's ladies' hormones are responsible for skin problems. If we can just have a quick, short answer for this
hormones are mainly related with acne.
Yeah.
So ladies having specifically polycystic ovarian. So if there is a mild polycystic ovarian, it will reflect on your face. You can have some extra hairs on the face. You can have some acneiform eruptions. There could be a bit of a hair loss happening on the scalp. So for that, we need to kind of figure out what the problem is and treat it accordingly.
Okay. And the last one, please give us more information about, I'm just going to say it as a Taltz injection, Taltz injection.
Taltz. Maybe they're talking about a biologic, because I was going to come to that. That would be my closing statement.
Okay.
I'll just say that. So eczemas, especially now I'm again talking about atopic eczema. Most of the cases are kids, and these are some things which are not curable as such.
Right.
So you start with moisturizers, medicated creams, anti-allergics. In spite of that, the eczema is going towards a moderate and a severe variety. When I say moderate and severe, it's itchy, it's disturbing your sleep, the lesions are oozy, they are all over the body. Child is not able to do their activities, the quality of life has reduced, they are not able to go playing, swimming, their confidence is coming down. The FDA has approved biologics now for eczemas. It's been a while, not now. In fact, lately, biologic is nothing. It's basically an injectable form which controls your eczema like nothing else. It will just make your eczema vanish. The only catch here is you have to continue them. There are no side effects long term of biologics. So when I say FDA approved, so that gives a certification that okay, they have been tried and tested in that age group and everything has been found okay to use. Earlier they were for plus 18. Last year they were approved for 12 plus, and now last few months over 6 years of age the biologics are approved. So these are injectable modalities of treatment of moderate to severe eczemas where you have to inject every 2 weeks. So that's one biologic. Another one has come up which is similar to a biologic, but it's not a biologic, it's in the form of tablets,
Right.
but that is for over 18. So they bring your eczema under control like nothing else would. So if I have a person, if I have a kid, I've tried everything. I've tried steroids, I've tried non-steroid creams, I've tried moisturizers. Still, the eczema is there. So we can't tell the kid, okay, wait, you turn 12, 13, like it'll go by itself. We can't do that.
Right.
So the catch is, it's not curable eczema, but you can bring it under absolute control. Control to an extent where you just get the injection every 2 weeks and you just moisturize the skin and everything is okay. No rash, nothing. You're doing all your activities. So we undermine this factor which is quality of life.
Yeah.
That's what's get affected in eczema more than anything. It's your quality of life. You know, you're not going out to play, you can't go to pools and you're not able to sleep and this is there and you're kind of not very well in your mind about this. So biologics have changed it big time in eczema, especially the atopic eczema.
Dr. Rahul, thank you so much for this informative session. I can't tell you how many questions that we've been receiving. There's a lot of questions, even the ones I've prepared. I mean,
no, thank you for inviting me. This topic is something which is very common. We see eczema so common, and I spent 2 minutes writing the prescription, but 15 minutes explaining to my patients. Sure. So I'll just keep pen and everything aside. I'll just talk to my parents that okay, what it is and what it is not, because they usually are not sure. They have been showing it, but they are not sure why it is coming back. So I need to explain them. Yes. Prescription is just 2 minutes, but the knowledge that you have to impart is more important.
Absolutely, and this is why we're here and our sessions are taking place, is to raise awareness and increase knowledge of our conditions. There's so many things that we're not aware of. I myself, every session I do here, I learn something new. I hope that you're learning from us as well from those sessions, and thank you so much for submitting your questions. I hope that we were able to answer them. Today we had Dr. Rahul Chaudhary, a specialist dermatologist at Medcare Medical Center, Discovery Gardens. Until then, take care, stay safe, and stay healthy.
Thank you.